My guest today is Dr. Matthew Dawson, who has years practicing as a physician and an associate professor, as well as having traveled the world training thousands of doctors on point-of-care ultrasound techniques. In today's episode, Dr. Dawson and I talk about his company, Wild Health, a precision medicine service providing personalized genetic-based care to help patients achieve optimal well-being. Welcome to Lifeology.
Thank you. Excited to be here.
I am looking forward to this as well. You all approached me on Instagram to work with you. So I was excited to work with your doctors and had my own genetics test done. And so I was actually surprised with some of the things that came out of that. So we can talk more about that later. But before we do, I was curious. I always like to get people's origin story. How did you get into or did you always know you wanted to be a physician?
Yeah, well, not always. I think I was 6 years old when I told my mom I was going to be a doctor. So the first 5 years, had no idea what I wanted to do.
Well, the fact that you knew at that age, that's pretty neat. That's funny. As you started to learn more about medicine, what were some of the things you appreciated about it and some things you wanted to change?
Yeah, initially when I was younger, I just wanted to help people. I thought it was an interesting
Yeah, of course.
profession. When I got into it, though, it was exciting at first, but I was in traditional medicine. And what I
Mhm.
found was I originally was working in the emergency department. We'd have patients come in, and it was very exciting to save someone's life, make an impact. But I kept seeing the same things, the same people come back over and over. And I realized that
Mhm.
in traditional medicine, people weren't getting better. We were just putting band-aids on
Sure.
things. They were coming back. And I really wanted to do more and move more upstream and try to prevent some of those
Mm.
things before they got to the stage where I was seeing them.
Sure. Now, sometimes people may not know what traditional medicine means. You want to describe what that is for us?
Yeah, it's traditional medicine that you go to your doctor, your primary care doctor, or other places. And it's a system that I think most people that are in it realize it's not really
Mhm.
working. There's a lot of incentives at play. And
Yeah.
instead, what we do now is more root cause medicine.
Mhm.
Specifically, and how we got started is about 5 years ago. My co founder and I, Dr. Mike Mallon, we saw a lot of evidence emerging around genomics and precision
Okay.
medicine. And it seemed like for the first time, even though we've been talking about genomics for years,
Mhm.
that we could actually do really personalized medicine and treat people down to the level of their DNA. And that was very exciting for us. As we were seeing that evidence, though, we dove in immediately. We sequenced our own DNA, and as we went through, my partner, he had a really difficult medical issue. We found out he
Mm.
had really high lipids, really high cholesterol, like a
Okay.
dangerous level, not just a little
Mm.
bit elevated. And he saw his regular doctor, traditional medicine. He had him try a certain diet that works for most people, but he got worse. He then wanted to
Yeah.
put him on a
Interesting.
statin, a medication, and we were a little
Mm.
worried about some side
Mhm.
effects from that. But again, he was getting worse. His doctor said he should take it. He took it. Sure enough, he had muscle breakdown, myopathy
Oh
from it, didn't
gosh.
tolerate it. And as he was going through this, we looked at each of our genetics, and we saw that a
Mhm.
couple things. Number one, he probably needed the exact opposite diet his doctor recommended. Number
Oh wow.
two, that medication, he had a very specific SNP, single nucleotide polymorphism, that made him
Mhm.
almost guaranteed to get that muscle breakdown and myopathy. And
Oh
we
wow.
were like, why did he have to suffer? Why did his doctor not know this?
Sure.
And we had kind of a light bulb moment where we're like, oh, yeah, the evidence and science is there and no one is doing this. So
Mm.
we became really motivated. We dove in, we started doing it for our friends and family and other physicians and just got incredible results.
So for the standard care for what your partner would receive was what obviously what the doctor prescribed. And so in that though, not every, it's just like we all hear that not everything is cookie cutter. So in that you're looking at the specific aspects of one's DNA. Going back to the genomes aspect of it, for some people who may not know what that is, obviously we're talking about one's DNA, the genes that everyone that's passed down from our parents as well. So as well as you're looking at the as you said the symptoms as opposed to the as what traditional medicine would do, would just look at the trying to fix the symptoms and not actually the origin of it. Um, Going back to the whole part of it, when you started the aspect of looking at the DNA and really understanding the mechanics of it, how far back would we want to have to go? Because are we looking at what a precipitating aspect of it, as far as this is a possible thing I could have, or this is definitely what I'm going to have? You know, as far as the
Sure.
epigenetics that may come out in a person's
Yeah,
genes.
so DNA is important. So we every patient that we see, we sequence their DNA. That's your human
Okay.
operating system. That's to treat someone without knowing that is kind of crazy to me. However, your DNA is not your destiny. It only accounts for
Okay.
about 20% of your health outcome. The other 80% is
Oh.
epigenetics and how you turn those genes on and off. Everything that you do, your lifestyle, what you eat, how you sleep, your exercise, what your stress levels, all of that also has a massive impact. So we also look at a lot of blood work and biomarkers, measure things that make you
Hmm.
feel and perform a certain way now. And then we do something really strange in medicine, which is we talk to the patient. We actually ask them questions and about things we
Yeah,
can't measure. We pull in data from
sure.
wearables, microbiome data, an incredible amount of
Oh,
data. And from those millions of data points, we then come up with what is the perfect diet for you? What is the perfect
mm.
exercise plan? How are we going to optimize your sleep? It's an extremely personalized approach using an AI platform that we developed to give those precision recommendations.
So with functional medicine, that really looks at the whole aspect of one's the holistic aspect of one's life. And so you've taken the functional medicine and you've you've taken like 5.0 version of it. I mean, so it's really neat to see how specific you all are with that as well. Now, I wasn't able to do some of those other things, but you actually give the biomarkers, or excuse me, you give the those types of monitors to your clients as well, so that you can monitor that
Yeah, so
virtually
we're pretty device
or
agnostic,
remotely.
meaning really
Okay.
anything you wear, a Whoop or a Fitbit, Apple Watch, anything that the data can come into Apple Health or Google Health, we pull in through our app
Gotcha.
as well as the blood work and everything like that. And just to give you an example, when we first started, one of the first patients we saw was my grandmother. She had
Mm.
Alzheimer's disease. She was already pretty sick. She had a MoCA score of 16, which is kind of moderate dementia. And with Alzheimer's, you want the MoCA to go from 16,
Mm.
15, 14, but not 16, 10, 5, not fall off a cliff. Well, when we
Oh, okay.
saw her, we got all of the data, got her on an extremely personalized program. And within a few months, instead of going down, her MoCA went from a 16 to a 20, which was unheard of to have a
Wow.
25% improvement. So I immediately saw my mother because I was worried about her genetics being passed on from
Hmm.
my grandmother. And sure enough, she had an ApoE4 gene. This is a gene that puts her at 2 to 3 times increased risk of having
Hmm.
dementia. That's what I was worried about. She also was a metabolic wreck, insulin resistance,
Hmm.
obese. And in 3 months of putting her on the program, she lost 40 pounds, reversed her insulin resistance, said she
Wow.
felt 20 years younger. We put my partner's mother on the program. She lost 80 pounds, got off all of her medications. And that's what happens when you actually go
Mm.
deep to the level of the DNA and
Yeah.
treat people according to how they should be treated, not cookie cutter, like you mentioned.
Sure. It's interesting that you talk about your grandmother's to be able to do this for her as well, because oftentimes people think, oh, I'm too old to do this, or it's my genes are set in stone. So I'm glad to talk about you say that the DNA is only what 20% you said
Yeah.
of one the foundational part of it, and so it doesn't matter what age. It sounds like that if something can be reversed or something can be treated, or you can be preemptive with it prior to it actually happening in one's life. So is there really any age at all that people wouldn't be able to use your services?
No, I don't think we've treated anyone over 110, so I can't say definitively,
That's fair.
but no, I
That's funny.
think taking a personalized approach to anyone, and it
Uh,
is, and if someone already has a disease, they're going to have a big impact from having personalized treatment. And if they don't, like my mother, like that risk factor, like when her ApoE4 used to, people didn't want to know about that because they thought, okay,
yeah.
this is not a death sentence, but I'm going to get this. What I told her when we found that is, Mom, this is great news. Like we see this and
Mm,
we know how to prevent it. Your DNA is not your destiny. We're going to do something about it. We're
yeah.
going to keep you from getting this pretty horrible disease.
Yeah. If I remember correctly, I don't remember what my score was, but I was somewhat predisposed for that as well. I don't. I have the report here in front of me, but I don't know what page it's on. But yeah, that when he told me about that, I was like, oh my gosh, because it was kind of scary, to hear that. So that I have my markers are more towards that. But thankfully, none of my family has had any Alzheimer's as well. Now, when you break down all the different aspects on your report, walk me through the different components because it's very comprehensive. Like you said, you look at every component of one's life. With it being so precise, how do you help your patients kind of navigate through it all? Because it's a lot of information.
For sure. Yeah. It's a really great question, an important question. So every patient, they not only get a 50 something page report, but they get a physician, they get a health coach. With our program, they have unlimited health coaching visits. We do 4 doctor visits a year, quarterly visits, like really focusing on preventing and optimizing someone. You don't need a
Yeah.
disease. We want to prevent it. We want to make you your best you. We have a lot of, like I said, my grandma with dementia. We also have a ton of pro athletes and CEOs and
Mm,
executives and folks who just want to get that last 1% as well. So it's a relationship component too with the health coach and
mhm.
physician to help guide you through the process.
Now, a lot of people who have maybe never experienced this before, worked with individuals like yourself. Sometimes people are just even afraid to go to the gym because they have this fear of I don't want people to really see who I am, or I'm trying something new. How do you kind of offset or help people just kind of normalize the process for you all? Because it's a lot of information. Some of it can be very scary. For myself, hearing that I may be predisposed to dementia, et cetera. Those things, that's a lot of to learn. And so to have so much change or so much knowledge given to a person, how do you kind of normalize that for them to help them understand that this is a good thing, to handle this information as opposed to the fear component that they may have.
Yeah, I think it's a mindset thing. I mean, when we talk to patients, I think the data is very empowering. No, I mean, if you just listen to podcasts or read on all the things that could happen to you, that's scary, in my opinion, not knowing what's
Sure.
going on. But then to be
Yeah.
able to see what you're predisposed to, and then to be able to have a specific plan, in my mind, that's just very empowering, and that's how we talk about it with our patients.
Which I think is great as well. When the people work with you, how long is this? How long are the services usually based for? Or like a
Yeah.
year
As
ongoing?
as long as they need. It starts with a year, usually, because I mean it does take some time to affect real change. There's a behavioral component as well. We work with people on kind of blocks, whether they're emotional or psychological, as well as
Mm-hmm.
to how to make the changes, not just what they should do. After a year, it just depends. If someone needs to continue, if they've still got issues to work on, we continue working with them. My goal and vision is always to graduate people, to teach them, educate
Yeah.
them, and let them take
Yeah.
care of themselves. And in fact, in a few months, we have a product coming out that we've taken all of that, the algorithms and the IP that we built, and put it on a large language model to where, for example,
Oh,
right now, you could go to ChatGPT and say, design a 7-day workout plan for me or a 7-day meal plan. And it'll give you something. But what we've done is we have that where you can ask it those things, but it knows your all of your DNA, your 700,000
oh
SNPs,
wow.
all of your blood work, all of
Holy
your
cow.
data, everything from your past, and it can give you an extremely personalized version of that as well. And
Wow.
we have that now. So if you were to ask your provider a question like
Mm-hmm.
that,
Mm-hmm.
that LLM is going to give them a recommendation. It's already kind of behind the scenes, but in the next few months, we'll be releasing that to everyone as well, or
That's
initially to all of
incredible.
our patients, and then eventually to others.
Sure. Wow. That's very pioneering of you. The when so that I was thinking about this as well. So let's say I'm at my current age, and so I learn everything that you've all have taught me. I've implemented everything. As I age, though, some things may change. Or obviously, things will change. But is there a kind of a jump start again where I would come back to you all and work with you again, or is this something that would be more ongoing as far as what I learned will be able to be maintainable?
For sure. And that's the deal. Like everyone, what is perfect for you when it comes to diet and
Hmm.
exercise and all those things, is probably different than what's perfect for you in a year from now. So
Yeah, that's
certainly
fair.
we continue to work with people. And the age, I'm glad you mentioned that. One of the tests that we do too is, there's a company called True Diagnostic, and we do these biologic age markers. And
Hmm.
specifically, we use a specific one called the PACE score. So this was developed by
Okay.
Duke. And what we do there, it gives you a rate of aging, which is a really good biomarker for how we're doing globally instead of just one biomarker that we're using, uh,
Hmm.
for your hemoglobin A1C or for liver health or for kidney health. So with this pace of aging, why we like that is because it's very sensitive to intervention, meaning your rate of aging goes up if you have a car accident, if you get COVID, if you get
Oh,
pregnant, actually, your rate of aging goes up, but it comes back
interesting.
down if you deliver or when you recover from COVID or whatever it is. So what we'll do is we'll measure your rate of aging, and then we'll do interventions. We'll try different supplements,
Hmm.
different diets, and then we'll check that again and see if we've slowed your aging down, or if this
Interesting.
intervention doesn't work for you and it speeds it up. And that's a really cool biomarker. It's just
Hmm.
another thing that we look at.
When people are experiencing chronic stress, obviously, I'm assuming their age is going to increase significantly. If that happens for a certain period of time, does it come? I mean, obviously, your body will break down with too much chronic stress. But as how would that kind of affect a person if let's say their age is, I don't know if this is even possible, it shows that the pace age is, let's say, 5 6 years older than what the person really is. How does a person, I mean, do you treat that current age is older, the older version, or how do you treat the current version? How does that work?
Yeah, I mean, the age itself is not that important to me. If you're
Okay.
chronologically 40 and your biological age is 36 or 44, I'm going to try to optimize you,
Okay.
period. What I like about the
Okay.
pace of aging is it doesn't give you an absolute number, it gives you your rate. So it's going to go from like zero
Oh, I
point
see.
0.6 to 1.4. So if you're at 1.0, you're aging at a normal rate. We want you to age more slowly. So if we do see
Gotcha.
you're at
Fair.
elevated rate, like your test comes back at 1.1,
Mhm.
then we want to dig into exactly why and look at all your biomarkers, talk to you. Is it chronic stress? Are you not sleeping well? We're tracking that.
Mhm.
What is it exactly that's accelerating that? And then we're going to attack that issue.
I see. Now, for what I've heard thus far, I haven't really, like you said at the very beginning of this, no one's really done this before. I mean, so being on the cutting edge of this, or the pioneers of this, obviously you've learned a lot as your company continues to grow. What are some of the what are some of the I don't want to say the next steps because we'll talk about that later, but what are some of the pioneering components of this that has kind of revolutionized this space here?
Yeah, I think the important thing is, I think one of the things that medicine, traditional medicine gets wrong is they treat people as a collection of organ systems. Like if
Mm.
you have headaches, you go to a neurologist. If you have chest problems, you go
Oh,
to a
that's right.
cardiologist. Abdominal problems, you go to a GI doctor. We're not a collection of organ systems. We're a whole person. So we take this whole
Mm.
person
Yeah.
approach and get an incredible amount of data, because any one thing that we treat may have negative impacts in other areas. So it's the really holistic approach and using this much data and using AI to look at the
Yeah.
data that I think is different than what other folks are doing. I mean, our
That's
platform that we built, we've spent tens of
yeah.
millions of dollars developing that, and so it's necessary to be able to crunch the amount of data that we collect.
Certainly. So yeah, with that much data, you definitely need to have AI help with that. I like how you recognize that, there's different specialists for different things, which makes sense. But when you holistically look at a person, it's going to be different. I've had different patients as well, slightly different providers in my field, and we have a different perception of who that, what the patient is presenting with. And so in that, you're going to have some discrepancies, but your markers there, you can't, data doesn't lie. Whereas maybe more of the subjective components of that, when people give their reports of how they feel, et cetera, it can be maybe have a different opinion. So I'm glad to see that you look at that holistically, and then all the data is there that you can use it to help them understand what's really happening within them. With all that's happening, so I'm curious to hear though. So you're working with your grandmother, and you have other people as well. What's the youngest age that you can work with?
So right now we're working with adults, so 18 and over. And the
Okay.
main reason is just because of the ethical concerns of, are we going to sequence someone's DNA who can't
No.
completely consent to it? So it's really
Yeah, that's
about
fair.
that. It certainly would have a benefit for for kids and younger folks as well,
Hmm.
but just from that kind of ethical standpoint, we work with 18 and older.
Okay. Now, to be more specific with this, because as we all have investments that we invest in our lives in many different things. And so there is a cost that comes along with this. Can we talk a little bit about the price point of that? Obviously, there's so many wonderful things that are come along with it, but we want to see how people can continue to work with you all and to be able to afford this as well.
For sure. Yeah. So and it's an important question for sure. So it's the cost. We do the DNA sequencing, the blood work, the platform, the 4 physician visits a year, the unlimited health coaching. So there's a lot of value that we're
Hmm.
providing. And because of that it's a few $100s per month.
Hmm.
So it's a couple lattes per day.
Hmm. Yeah.
We have other kind of concierge programs where we're doing full body MRI and cardiac CTA AI as
Hmm.
well. Those are more expensive, but the standard program with the 4 physician visits a year and all of the data is between $300 and $400 per month. Now that um, where I came from, I grew up very poor in an area where no one where I came from could afford that. So that's been an issue for me for a while. As I mentioned, the large language model version,
Hmm.
that excites me tremendously because when that comes out, that's going to be something that can be delivered without all of the physician, the health coaching time,
Wow.
and all of that. And so that'll be more like single dollars or tens of dollars
Hmm.
per month to be able to get a similar precision medicine that doesn't exist elsewhere. And so when that comes out, I'm very excited. Our current clients, they'll have options of, hey, do you still want the doctor and health coach, or do you feel good about where you are and you just
Hmm.
want the precision medicine and the advice as well? So I'm very excited about that coming out in the next few months, because then I think it'll be affordable for everyone. Right now, it's for those
Good.
who really want to make the investment in
Hmm.
their health, which I think is worth it. But as you said, not everyone
Yeah.
can afford it.
Yeah, not everyone can afford it, and we also sometimes like you said, when you look at our spending, a latte every day does add up, and so it's good to look at all our spending as well. Uh, but I did find that when your doctor mentioned something to me, I was able to go to my general provider, and I said, "Can I have this test done?" And so my insurance actually covered that test, and so there are some workarounds with that as well for people that if they do need some additional assistance, perhaps their insurance would cover some of the cost as well, which is neat. Well, I'm not sure if you're able to say, but when this chat component comes out, is it the next couple of years? Do you have a rough timeline for that?
It's there, it's ready. So for our current patients
Oh,
who are in the
internal. Okay,
program, it's
gotcha.
going to be in the next 2 to 3 months that we'll be releasing it. I
Oh,
use it
okay.
every day, so I already have it. It's in beta. It's on my phone. It's so much fun. I play with. I mean, I was sick the other day for a few days, and it was driving me crazy because I couldn't work out. It just didn't have the
Mhm.
energy. So I said, hey, I'm feeling sick. Tell me what to do the next few days, and it could read my HRV from my wearable the night before. It saw my
Wow.
HRV was down, my resting heart rate was up, and it knew that I was feeling sick. So it gave me a wonderful workout that still got me moving and would help with recovery. I'm not going to get stronger. I'm not going to get more fit with it, but it's amazing to be able to have that assistant there, like having a doctor in
Yeah.
your pocket that knows everything about you. So that'll be out in the next couple of months to all of our clients, to just the general population, probably
Sure.
within
Yeah.
the next year or so. But initially, it'll be to our patients, and we'll let them switch
Okay.
to that lower cost model if they'd like to.
With the beta model there, does it also include any type of mental health suggestions, like for self care? So I know obviously for the medical aspect of it, but does it integrate that as well?
For sure. And the great thing about it is it's like it'll give push notifications. Like it may
Uh-huh.
say to me, hey, look, your HRV is down, your workout was hard, we noticed. You also haven't been eating enough calories, things like that.
Oh,
And it'll
okay.
give you suggestions on how to optimize. But there's also has a chat component. So you could simply tell it, hey,
Hmm.
I'm feeling down today. Any recommendations? And it may look at your genetics and say, yeah, you have a
Oh.
COMT gene or these other things, or your lab work. Looking at your lab work, your omega-3 levels a little low, and you have a FADS2 polymorphism in your DNA, you probably need more omega-3. That may help you,
Hmm.
or give you other recommendations as well.
Wow, that's really cool. Actually, I mean, I know obviously about the Chat GPT, but to have it be specific like this for one's DNA, it's revolutionizing. With everything you're doing, I can't even imagine what's coming next for y'all. But do you have things in the pipeline as well beyond the chat component?
That's the one we've been focused on. I mean, because
Okay,
in my
rightly so.
mind, that gets precision medicine, this most cutting edge medicine, to the entire world. So that's
Yeah.
that's what I'm most excited about. And it's really just going to be continuing to optimize that, continue to get people into the platform so it gets better and better.
Hmm.
None of this matters unless you get results, and our results are
Yeah.
incredible. We've published a white paper, and for example, diabetes. You know, metabolic health is critically important in
Hmm.
traditional medicine. Type 2 diabetes is reversed about 3% of the time. In our patients, it's about 48% of the time that's reversed.
Wow.
So we have the outcomes. We just
Wow.
have to get it into the hands of more people.
Yeah, I was going to ask you that as well because with traditional medicine, obviously you have a lot of colleagues that you work with, and so with the information you have from the genetics component, it would how is this? How do I say this? How is your work? How is it received by
Mhm.
Western medicine?
Yeah, doctors get it. Like they know with in traditional medicine, it's just not fun. It's not working. So we actually developed a fellowship program as well to train
Wow.
providers. So we've taken hundreds of providers through our course. It's a 12-month course that has CME attached. There's also a
Oh wow.
course for just training lay people who want to become a health coach, for example. So we're trying
Wow.
to solve the problem as well of getting this out by just training more providers.
Wow. That's great to hear. That's nice. And so with the because as we know the medical health model has changed significantly throughout the years. As you know, there's it's it does I don't want to say it doesn't work, but it's just changed significantly. So with this, do you see what you're teaching as well? Do you see that this is the direction that most physicians will go towards?
For sure. Doctors want to do what works, and
Hmm.
patients are starting to demand a different way. So that there's
Sure.
there's a groundswell, people wanting this. Medicine 3.0
Excellent.
is kind of a hot topic. So yeah, I'm very excited about the direction it's going.
Apparently so. There's so much information here that I'm sure a lot of my, my viewers and listeners will have to watch this a few times because you've said so many different things that to me, like, they may think, well, I need to learn more about that, maybe research more about that. But because our time is up, if my viewers and listeners want to find out more information about you, to research everything, to learn more about this, to work with you all, where would they find this information online?
Yeah, just wildhealth.com, whether you want to be a patient or you want to take the course or whatever it is. We have a podcast, a Wild Health podcast as well, but wildhealth.com is where you could find everything.
Awesome. I highly endorse you all. Like I said, when I received the comprehensive reports, I was blown away by how much information was there, but also just the recommendations as well. And so I was telling you in the pre-call that when I was reviewing it again today, I was like, oh crap, I haven't taken my creatine in a while. So for me, that was specifically what I need to take. So it was kind of funny that I mentioned that, but it is important. So once again, I highly endorse you all. Thank you so much, Dr. Dawson. I appreciate your time. And my viewers and listeners also know that they can't find this information any other place. Simply go to the show notes at jamesmillerlifeology.com and I'll with Wild Health. Thank you so much for your time.
Thank you.